Hi, everyone. Welcome to this workshop on neurotransmitters and your brain health. Now, this is a really important topic because in today's world, there are too many people who are depressed and anxious and having problems with OCD, especially after COVID. We've got a lot of children who, because they were having to stay in house, they are suicidal even. So when anybody comes to me and says that they're depressed, I pay attention. And this is a talk that's going to give you some ideas of why you or a loved one is having feelings of depression or anxiety or OCD or any of the other things we're going to talk about, and how we can test to see if your neurotransmitters are out of balance. Those are your brain chemicals, and solutions. So let's get started. I'm going to share my screen. So our subject today is about neurotransmitters and your brain health. And this is an important topic because too many people and children these days are depressed and anxious. And depression is nothing to fool around with. So if you feel depressed, you need to seek help. Or if you know someone who has said that they're depressed, you need to maybe direct them to somebody who can help them. Because there are natural solutions that don't require drugs. So today you're going to learn if you're one of the 85% of Americans who have suboptimal neurotransmitter levels. And you'll learn about the 5 chronic conditions associated with these imbalances, like depression, anxiety, insomnia, impulsivity, fatigue, PMS, PMD, OCD, ADD, and so many more. So what are neurotransmitters? Neurotransmitters are chemical messengers used by the nervous system to relay information from one nerve to another, and they affect your brain function. Neurotransmitters are chemical messengers that relay information from the brain and throughout the body. And a few factors that impact neurotransmitter production are your genetics, environment, chemicals, stress, and nutritional deficiencies. But let's go back a minute to genetics. Now, just because you have a genetic SNP, that does not mean that you are going to get that disease. What it means is you have a possibility, but we can prevent that from happening. Genetics are just the gun. It's your diet and lifestyle that's the trigger that allows those genetic predispositions to trigger. And we can prevent this. So once out of balance, the nervous system begins to compensate, which in time can lead to neurological or psychological symptoms affecting the brain. Optimal neurotransmitter balance is required to maintain proper brain balance and health. Imbalances can cause the brain and the body to be overstimulated, producing neurological or psychological symptoms such as anxiety and depression, and elevated glutamine can lead to panic attacks. Chronic fatigue, which is an imbalance between excitatory and inhibitory neurotransmitters, can lead to persistent fatigue, impulsivity, GABA, dopamine, serotonin, and 3 chemical messengers commonly linked to disorders like ADD, ADHD, and OCD. With insomnia, you might have imbalances in glutamate, histamine, dopamine, GABA, and serotonin. These are all linked to sleep disturbances and insomnia. PMS or PMD have to do with imbalances in serotonin, dopamine, norepinephrine, and GABA, and are often involved in cases of PMD, which is premenstrual dysphoric disorder, and then there's severe PMS. So stress, diet, toxins, drugs, alcohol, and nicotine are just a few factors that can negatively affect brain function. Fortunately, we can test neurotransmitters with a simple urine spot test. And then depending on symptoms, we might need to do some add-on tests that can be included, things like hormones or adrenals for stress that cause insomnia and fatigue, or female or male hormones that cause other symptoms. Or we might need to add on thyroid hormones for severe fatigue and other thyroid symptoms, or elements like heavy metals. Heavy metals are very damaging to the brain, and they disrupt neurotransmitter function and create oxidative stress that's detrimental to nerve cells, contributing to mood disorders, poor memory, and dementia. So identifying exposures to heavy metals may actually be the key to accessing and treating mood disorders and preventing neurodegenerative diseases such as Alzheimer's. Now, in contrast, nutritional elements are generally protective for the brain. There's things like lithium, and there's natural lithium products that act directly on the brain by slowing the progression of dementia and stabilizing mood, while elements like iodine and selenium act indirectly on the thyroid and support healthy thyroid and brain function. Now, there's 5 conditions commonly associated with neurotransmitter dysfunction. And we can test to see if you're out of balance and apply natural solutions to bring your neurotransmitters back into balance so you can feel sane again. It's easy. You collect your urine and place a few drops onto a card, and then you send this to the lab. I receive the results within a week, and together we plan your road to recovery. So if you or a loved one are experiencing these symptoms, don't wait. I take it very seriously when anyone tells me that they're depressed or anxious. So let's talk about the 5. Number 1, anxiety and depression. Did you know that 16 million US adults have at least one major depressive episode or experience depressive symptoms? Neurotransmitter imbalances are often associated with anxiety and depression, specifically glutamate, which causes panic attacks. There's PEA, histamine and serotonin, as well as epinephrine and norepinephrine. These are all neurotransmitters. And there are natural products like SAMe or 5-HTP that help increase serotonin and make you feel good. But I caution you with these. You need to have someone guiding you with these, because you can't take these if you're on antidepressants or have bipolar disorder, because it can cause mania. But if you're not on antidepressants or you don't have bipolar disorder, these products can really make a difference. Just a matter of days, make you feel really good about yourself, help you focus, and just get your life back. So to reduce anxiety, you can use natural supplements derived from green tea like L-theanine, which calms the excitatory neurotransmitters and induces alpha waves in conjunction with taking calming herbs like valerian root. I usually recommend a synergistic formula that addresses anxiety and supports the adrenals, because the adrenals get taxed when you're anxious. So during your wellness consultation, I would ask you important questions that help me determine what the root cause is. And then there can be many. Things like, I might ask you if you feel bloated or your tummy hurts. That might indicate you have a candida or fungal overgrowth that causes anxiety, not just neurotransmitter imbalances. And I could add that on. And of course, I would want to test so I know what the root cause is and how to address it. Make sense? Number 2, insomnia. How many people have insomnia? Oh my goodness. I think 9 out of 10 women that come to see me have insomnia these days. Short-term insomnia affects up to 20% of adults, while chronic insomnia lasting over 3 months affects about 10%. Is your husband over there snoring while you lie awake? How many women tell me this? Oh my goodness. Imbalances in glutamate, histamine, dopamine, GABA, and serotonin are often linked to sleep disturbances and insomnia. And these are easy fixes once we know what they are. But if you're stressed out, you might have elevated cortisol in the evening. This is when cortisol should be low. This will keep you up if you have elevated cortisol. So I would do an add-on saliva test to check cortisol levels. It's important to stay away from your phone, your TV, or any device with a screen because the blue light increases cortisol. So these are just some of the things that I might have you do. Number 3, impulsivity. Disorders like OCD, obsessive compulsive disorder. Obsessive hand washing. You wouldn't think that that's an obsessive disorder, but it is. These affect 3.3 million people in the United States alone. And the CDC also reports that 11% of school-age kids suffer from things like ADD, while it affects 4% of adults. So GABA and dopamine and serotonin are 3 chemical messengers commonly linked to disorders like ADD, ADHD, and OCD, all of which are neurotransmitters. Let's talk about fatigue. How many of us are fatigued? I think it's an epidemic today. They say only 20% of Americans claim to have fatigue, intense enough that it interferes with living a normal life. But I find there's more people that are fatigued these days. But so an imbalance between excitatory and inhibitory neurotransmitters can lead to persistent fatigue. Also, exhausted adrenals can do this, or thyroid hormones being out of balance. So I would probably add on to your neurotransmitter urine test to find out if any one of these things are a problem. But of course, your symptoms would indicate that in your initial wellness consultation. Let's talk about PMS and PMDD. So severe PMS affects 1 in 20 women, and PMDD, which is premenstrual dysphoric disorder, affects about 5 to 8% of menstruating women. And these are caused by imbalances in serotonin, dopamine, norepinephrine, and GABA, and are often involved in cases with the PMDD and also with severe PMS. So if you think your neurotransmitters or your hormones may be out of balance and causing your symptoms, there are simple steps that you can take. First, you should book a wellness consultation with myself, Dr. Teresa Rispoli, so I can order your lab test, and you can either come into my office in Agoura, California, or book a virtual consultation. And the test kit can be mailed to you. You simply collect your urine and put a few drops on a card, and the kit will be mailed to you free of charge. And then once you're done, you mail the kit to the lab, and I get the results, usually within a week. And then I'll contact you and set up a report of findings appointment and give you a step-by-step plan to get your body back into balance. Why suffer? So if you're not sure it's your neurotransmitters or hormones or adrenals or thyroid, you should schedule a wellness consultation with myself to help you figure out what's the best test for you and the best solution. You can also download ZRT's neurotransmitter patient handout and take a brief patient quiz, which will help you identify if it is your neurotransmitters. And there's a link down there. You just go to zrtlabs.com/media and follow that link and see if it is your neurotransmitters or not. But one thing I want you to know is I urge you not to wait if you have symptoms of depression or anxiety or even insomnia or OCD, or someone you know has aggression or ADD or ADHD. If you're fatigued and you have brain fog or forgetfulness, low libido, mood swings, panic attacks, or poor concentration. These all diminish the quality of your life. And it's simple to figure them out and get you healthy and vibrant. These are all symptoms of neurotransmitter imbalances that can easily be corrected without drugs. But you have to make the first step by scheduling your wellness consultation today, either virtually or in person at Dr. Rispoli's clinic in Gore Hills. It's easy. Just go to teresarispoli.com and book your appointment there. No blood draw is necessary, and the lab kits can be mailed. Neurotransmitter testing can provide a framework for understanding the connection of our body's physical health and our brain's well-being. I, Dr. Teresa Rispoli, have been in practice in the same location for over 30 years. I have a PhD in clinical nutrition, a doctorate in naturopathy, and I'm a licensed acupuncturist and esthetician and herbalist. I also have an online academy where I train people all over the world on how to become a board-certified functional nutritionist. So if you're interested, if you have a drive to help people, we need people like you. So go to functionalnutritionistacademy.com and learn about our course. We have a free course catalog there, and I have a free gift for you there if you go. Now, if you're a student of Functional Nutritionist Academy, the ZRT lab is a great lab to add to your toolbox of functional labs. And these tests are easy at-home tests derived from dried blood, saliva, or urine. So remember, if you're having symptoms of depression or anxiety, you can't focus, you have brain fog, OCD, you have ADHD or ADD, or any one of the things that I talked about. These are simple fixes. All we have to do is test you. But you have to make the first step. You have to book the appointment. So again, you can go to my website, teresarispoli.com, and either choose virtual or an in-office wellness consultation. Now, if you're interested in becoming a board-certified functional nutritionist, where you can help people, you can order lab tests. It's an amazing course that I put together over 30 years of my clinical experience, my education, and it's affordable. And it's all completely online, and you can do it in your own time. So look into that. And I want to thank you for joining me today. And I hope to see you in the office or, through a Zoom call virtually. So don't wait, don't hesitate. You need to act now. And we'll talk soon. Thank you. Oh, any questions? I want to ask if there's any questions. Go ahead. I'll unmute you if anybody has any questions.
No, but I really appreciate this. I like having, like you're saying, so you have some more tests to add to your, your toolbox.
Yes. Also, through Rupa Labs, now you can order your tests through me. So most of the tests that I offer, you can now order, which makes it really cool. Yeah. Rupa Labs. So you're gonna, once you go through the course, actually the very last lesson explains all of that and I've updated a lot of the lab tests, and I've added a lot of the newer functional lab tests that are coming on the market today. So you'll get a better understanding. And just so you know, each lesson that you take, I explain about the lab test associated with that area of the body. Like if we're on thyroid, I'll explain about the test for thyroid. If we're talking about adrenals, I explain about the testing for adrenals. If we're talking about hormones, I explain all the tests for hormones. If we're talking about the gut, which I know you're interested in, I explain about all of the tests about the gut. And there are a lot of different ones. So how do you determine which one, like GI map versus, Vibrant Health, gut test? I mean, there's a lot of different tests. So some of them have to do with autoimmune, some check the DNA of the bacteria, some are looking for bacteria that affect the brain. In an instance like this, some bacteria actually can trigger autism, and once we figure out what's going on, we can actually get a person so they're normal again. It's really exciting and interesting information, and it's all there. So you just need to continue on and keep taking your courses, your lessons.
Yeah, and I appreciate you expounding on that, because I think that's a good thing for everyone to know, like whoever revisits this this webinar, because each, you have a test for like each of these areas, and as you go through the certification, and I like that too, that I can do things in bits and pieces. So like, yes, like you're saying, like right now I'm very interested in the gut. This matters to me and what I'm trying to achieve with my own personal business. But as I go along, and so you're only going to talk about the tests that involve that, which is good, because then it's not going to overwhelm and confuse me.
Exactly. And then the course is set up so it's like you're doing an intake on someone and you're going through the questionnaire. And so you're asking particular things about each area of the body. And so the course takes you through the areas of the body and how to pinpoint if that's an area that you should look at based on the symptoms. And then, of course, doing the timeline and figuring out, where their problem started and what might have triggered it, and what questions to ask in addition to your initial evaluation really helps you target what's going on with a person's body and the next steps to take, then maybe the next tests to do, maybe some supplements to try, solutions to get them feeling better. And the most important thing on that questionnaire is there's like 4 key symptoms or areas that they're concerned about. And you as a practitioner always want to pay attention to their number 1 through 6 problem areas and get some relief, before you start delving into, maybe heavy metal detox or something, which isn't anything related to what's going on with them. You have to stick to what's going on with them.
Right. I think that would help them too. It gives them more confidence in moving forward and uncovering other things that could be contributing as well. Yeah. So we'll see.
Yeah, a person wants to feel better. If they're coming to you, they want to feel better. And so by addressing some of the things and getting them to feel better, while you know that there are other underlying problems that need to be addressed, is really important. And then that way you can explain to them that these things need to be addressed as well in order for you to feel better. In other words, about this subject here, if we look, the person's got a lot of stress in their life and they're feeling really anxious. Is it driven by imbalances in neurotransmitters? Well, that's easy to test. But is it also being driven by extreme stress? And what can they do in their life to reduce that stress? How do we supplement them to help their body be able to handle stress? And then how do we improve their sleep hygiene so that they can get better rest? So these are all key things that we want to address.
Okay.
Yeah, so it's not just about anxiety, boom, do this test. We have to look at a broader range,
right,
to see what's going on. So that's what I teach in my course. And I'm excited that you joined. That's really great. And I hope that some other participants will think about joining Functional Nutritionist Academy, get certified, so they can go out and help more people.
Yeah, you couldn't have enough of us, because everything's so chronic right now. Everything is so chronic. Now, also too, do you have on your website a place where we can just go and say, we want to order this, and this test? Or do we need to?
Yeah.
Okay, perfect.
Yeah. So you can go to teresarisfoli.com, and there's a tab at the top. It says lab testing. And actually, the labs aren't individual. I used to be able to have that. What you have to do, because you have to be, well, if you're a student of mine or a graduate, then you're able to order the test. And I explain all that in the course.
Okay.
But if you're just a person who's interested in getting the test, then you can go to terrestrialrispoli.com, and in the chat box, you can say, I'm interested in ordering these tests. But then you'll have to fill out some consent forms, because I have to be able to treat you in order to give you the test, and to help you. And then I'll mail the test. You know, there's a private portal where I'll send you the consent forms, and I'll send you an invoice, and you can pay and get the test mailed to you, and you'll send the consent forms back to me. And then when the tests are complete, I'll schedule a report of findings with you through that portal, and we can do it, you know, either live or in person.
Okay.
Video chat.
Nice. Okay.
Yeah. And I teach you how to do that in the course.
Right, I know, but I didn't know if there was just like a place that we could go to just do that. So yeah, I jumped
wish.
ahead.
Yeah.
So
There is.
that'll be a
There is.
business.
Once you become a student and you graduate, like I said, through Rupa Health, you can order the test through me. I'm the doctor signing off on the test, but you're the actual provider. So it'll be under me, and then you giving it to your patient.
Okay.
Sound good?
Yeah, it's good.
Yeah, so you can order all these functional lab tests. It's amazing.
I know.
Help so many people.
I'm really grateful that I have a place where I can order them through. So thank you.
And you know, it's so important. I had a client who came to me, and she's just extremely fatigued. And some people, they think they know it all because when I explained to her what she needed to do in order to help her adrenals, I gave her some supplements. She balked at taking supplements, and I said, well, you know, adrenal fatigue is not something that's, you know, you take a couple pills and 2 days later you're better. It's something that takes, you know, 3 to 6 months if you're really fatigued to feel better. And then she goes, well, it's just a bunch of B vitamins and this and that. I'm like, excuse me, no, it's not. There's adaptogenic herbs and adrenal glandulars and other nutrients that support the adrenals. And you're not going to feel better in a week. It's going to take 3 to 6 months. So I guess when she understood that, then she was more willing to follow through with the program. And, you know, the often natural products and solutions it's not like a drug. It's not like a drug where you get instant relief, but it's safer. There's less side effects, and it's less toxic to the body than drugs. So that's why people come to natural health providers like us in the first place. And sometimes you have to remind them of that. You know,
right, because I do know that well, some people, like my body responds to herbs like prescription drugs. I mean,
yes.
and it'll and a lot of times what you'll find is if you're taking something for, let's just say, cholesterol, but then you're taking some natural herbs to help battle that, your body's going to always recognize the herb first, because it can actually recognize it because it's natural versus taking a prescription drug. Not saying that there's, you know, so, right. And I think that that's so interesting. I think that in and of itself shows you that the body is recognizing something natural. And if your brain can actually grasp that your body would actually throw out a chemical and then attach itself to the herb first, it's showing you why is that? Because it's something the body can assimilate.
Right, and prefers.
Exactly. I know it's a beautiful natural process, but I think it's also interesting what you said about like with building the adrenals, that's actually what you're doing. You're rebuilding something, and that takes time to build. We just don't go put up a building in a day. You have to
right.
And all of that. So that's interesting.
You know, and things like the thyroid, I have to explain to people over and over again. They go, why did my doctor test me for do a complete thyroid panel? And all they tested was TSH and T4. They said because medical doctors don't know how to treat the other things. So they're not going to test you for reverse T3 and free T3 and antibodies because they don't know what to do with it. They're not trained. We're health professionals, natural health professionals like ourselves. We can do that through nutrients that balance the thyroid and help it convert. Are key sometimes. And so I have to explain to them, medical doctors are not going to test you for that because they don't know what to do with it. It's just, and they don't know about all these functional labs. So it's kind of sad, well, my doctor's going to order a gut test for me. And I say, well, who's the lab and what are they going to test? Oh, they're going to check for parasites. I'm like, well, that's not enough because it might not be a parasite. It might be candida. It could be a bacteria. There could be other things associated with it. There could be inflammation. Well, I'll just go to my GI doctor. What does a GI doctor test for? They're going to do a colonoscopy. They're not going to know if there's inflammation in the gut lining or if you have leaky gut or, if you have inflammation. They're not going to tell you any of that. They're only going to tell you if there's a polyp. And that's what they're, unless they're a functional gastroenterologist. So there's a difference there.
Well, it's some really great information. You did an amazing job today, as always, and I appreciate these webinars. So thank you so much.
Okay, and we'll talk soon. I'm going to end now.
Okay, enjoy the day.
You too. Take care. Bye.
Bye.